How does that fit into this conversation? Are you mixing it together, or is it just sugar bad, no mixing, it is what it is?
Look, if you believe in glycemic index, then a Coke is perfectly fine because it's got a glycemic index of 53. Fructose has a glycemic index of 20. So you'd say, oh, low glycemic index food. Brilliant. Not so. Because fructose is beyond glycemic index. Fructose is a different phenomenon entirely. So if you want to use glycemic index,
so let's
and
roll
we
back
do
for the
that.
public part of the public members of the public forum. Andy, maybe you can explain glycemic index for
Yeah, the
everyone.
glycemic index is a way of measuring how rapidly a carbohydrate food digests and raises blood sugar. And in general, the advice that we have been giving people is that it is more desirable to eat lower glycemic load carbohydrate foods and meals than higher glycemic load ones. But I think this is very important information that sucrose, table sugar, has a relatively moderate glycemic load, and fructose is right down at the bottom. So this table does not capture that, and it doesn't explain its dangerous effects.
well, let me just qualify what you said, Andy. There's this glycemic index and there's glycemic load,
Right.
and they're not the same.
Right.
Glycemic index is how high does your blood sugar go when you consume 50 grams of carbohydrate in whatever food it is. Okay? Glycemic load is how much food you have to eat to get 50 grams
Right.
in that food. Very different. Carrots are a perfect example. High glycemic index, low glycemic load. Because to get 50 grams of carrots, you'd have to eat the whole friggin' Grimway truck.
And this is an example of how this information is misunderstood, is that many of the authors advocating very low carbohydrate diets tell people not to eat carrots or beets because they're have a high glycemic index. That's stupid nutritional advice.
So what we really want is low glycemic load foods. And low glycemic load foods is very simple. High fiber foods are automatically low glycemic load foods for all the reasons we just talked about. Because fiber in your intestine forms a barrier, a soluble barrier that prevents the rate of absorption, which gives your liver a chance to catch up. It reduces the flux. It's a dose issue, yes, but it's also a flux issue. It's both at the same time. And when you think of it that way, then basically fiber's your answer. So I'm for
All kinds of
low
fiber?
sugar. As far as I know, I haven't figured out
Soluble
if
and insoluble?
soluble and insoluble. I think insoluble is very important. People say, oh, if it's just soluble, we can add, guar gum, psyllium, all the added cereal fibers, then all of a sudden Fiber One bars look good. But, I think insoluble
But
fiber
Rob,
is actually very
I don't
important.
think that products made with whole wheat flour are very much different in their impact on the liver from products made with white flour. So in that case, whether or not there is fiber present, the starch has been transformed into a substance that rapidly converts to glucose.
Right. That's the difference between whole wheat and whole grain that you're referring to.
Which is something
that you
not
talked about
understood. Yes,
yesterday.
absolutely.
Yes,
Right.
absolutely. So
What is whole wheat?
To me, whole wheat should mean a grain of wheat or a grain of wheat that's cracked into a few big pieces. You can take some of the husk off, some of the bran off, but it's the grain, the entire grain, or the grain cracked into big visible
That's not the
pieces.
industry's understanding.
I am very aware of that, and the FDA.
So it's important to know.
No, it's very important to know, especially since the FDA allows seals to be put on Roman meal bread, saying this is a whole grain product.
Yeah.
I said yesterday that to me the test of of glycemic load in whole grain is whether you can take a piece of bread and crush it to the size of a marble. And if you can do that, that's the wrong kind of starch to be eating, whether or not it's got some of the fiber and bran ground up with it.
Especially if you can do it on day 7.
Exactly.
So what I'm hearing, let me just recap what I'm hearing so far. On the sugar front, don't take it in liquid form, was Andy's sort of perspective. Have it for celebrations was another perspective. Make it yourself was another possible way of going, and always look for it where fiber is. So we have
have it in the form that nature has always given to us, which happens to be with fiber.
So those sound like 4 at least reasonable approaches to taking on sugar.
Yeah, and I would say getting this culture to realize that sweetened drinks, sodas, fruit juices, that these are toxins. and they are very bad for us. That seems to me that would be maybe the single greatest thing that we could do, is to have people get that realization that this is not food, it's not good.
So
Well,
Rob,
you guys agree, can I just
Yeah,
interject?
sure.
You guys agree that sugar is a toxin. We usually regulate toxins in our society.
Let me jump in.
Yeah.
Okay, we have substances that are toxic but not abused. Vitamin A, vitamin D, iron, water. They're nutrients, except when you overdo them, they can kill you. But we don't have to regulate them because there's no abuse potential. We have abused substances that are not toxic. Caffeine, nicotine. I mean, Nicorette gum you can buy at the store. Okay, it's not the nicotine that's dangerous, it's the tars that go with the cigarette. But the nicotine in and of itself is just an abusive substance, but not toxic in and of itself. You don't die from nicotine. Okay, so we have substances that are toxic but not abused. We have substances that are abused but not toxic, and neither of them require anything from our government or from the food industry. They're just there, and we just deal with them. Then we have substances that are both abused and toxic. Cocaine, ethanol, morphine, heroin, cannabis, etc. Okay? Those we have specific regulations for. Those we have methods for reducing consumption, and government gets involved because they recognize there's a vicious cycle between consumption and disease, because they are both toxic and abused. Well, you've heard that sugar is a toxin, and I didn't even say it. Andy said it.
so it must be true.
Hey. And we also know that it's abused. So, what do you think we should do?
Yeah, Bob, that was my question.
So let's just talk about the public policy implications a little bit, because some things you've talked about before is that the WIC program or the poverty programs have encouraged juice drinking in children in inner cities in particular. And some of the policies we have are actually encouraging sugar consumption in a way that could be harmful. What have you thought about from a policy perspective? What should we be doing?
Okay, so let's start with where it all starts, the USDA, right? First of all, who runs the USDA? Okay, that is the mouthpiece of the food industry in terms of the government, because the USDA's job is to protect the food supply. And that includes protecting the food supply from people like me. And you. And you. If you look at the USDA, they have this thing called the DRI, Dietary Reference Intakes. So it has lower limits and upper limits on every single nutrient that we've got in our entire portfolio, except for one: sugar. There's no sugar. They can put it any amount in anything they want at any time. In addition, fructose is on the GRAS list, GRAS, generally regarded as safe at the Food and Drug Administration. So as long as that's the case, there is absolutely no compunction on the part of the food industry to change their practices. Are these two reasonable policies to continue?
So you would take fructose off the GRAS list?
I would.
Would you take sugar too?
Yeah, sure. Absolutely. Yeah.
And
Because
so-
I think that there's a limit to how much you can consume rationally.
So are these conversations happening yet?
Of course not.
It's very hard to move on sugar. I mean, a couple years ago, the UN tried to have set a dietary limit on the proper amount of sugar under the Bush administration, and our State Department got directly involved in lobbying to make sure there was no such thing.
That's right. In 2004, the World Health Organization wanted to declare a limit on sugar consumption, and Tommy Thompson basically threatened to withhold $400 million because of that.
And what was the limit they were proposing?
I actually don't know the number.
Yeah, it was generous, but it was below the amount Americans are consuming.
So for those of us who occasionally watch food programming, I'm really enjoying Jamie Oliver's travels around the world, and the addition of sugar in milk was argued by the school system as a way of getting children to drink milk, that's what was required to do it. And when he showed them the sheer volume of sugar consumed by their students over 1 week covered an entire school bus, they were still not willing to move on that because it was helping them consume other things. Do you hear that argument a lot?
Oh, I hear it all the time. But in fact, when you take the sugar out, when you stop the chocolate milk, consumption stays the same. It goes down initially, and then it goes back up again. So it depends on when you look at it. If you look at it 2 weeks later, it looks like there's a problem. If you look at it 2 months later, problem's gone.
So, but I want to stick on this policy questions and ask these guys another question or two. A controversy now brewing that's been raised by the Ag Committee actually in the House is whether we should. Right now, soda is permitted on if you get food stamps or SNAP payments, you're allowed to use that for soda. You're not allowed to use it for alcohol. You're not allowed to use it for candy. But that's a very controversial, would be a very controversial move with many hunger advocates. Sure. So where are you on that?
Oh, personally, I'm with Michael Bloomberg on that. I mean, he wants to basically take soda off food stamps. And I think that makes perfect sense. You know, people say, well, if we did that, you know, this is pejorative against the poor. Is it really? How much money are they spending out of their own pockets for their chronic disease? Wouldn't they be better off if their chronic disease was mitigated by dietary changes that were, in fact, government enacted?
Well, this goes back to why it's the liberty portion of our title here, because that's really a question of free choice, free will.
Right.
What should the government be involved in suggesting there?
And the argument is, well, if middle-class people can buy junk food, why shouldn't poor be able to buy junk food? And the counter-argument would be, well, okay, with your own money.
Yeah.
Not with tax dollars. Tax dollars should not be subsidizing an epidemic of type 2 diabetes.
Well, how about this? Why is junk food cheap?
Well, then we get into policy.
Okay, so yes,
Yeah.
of course we get into policy. Why is junk food cheap? Because
The government makes
the
it
government
cheap.
makes it cheap, exactly. And why do they make it cheap? Because we have this thing called corn subsidies. So corn subsidies, I mean, 16% of all of the corn grown in the United States goes to high fructose corn syrup. So what would happen if you got rid of the corn subsidy? There is not one economist worth their salt in the entire U.S. that doesn't work for the government that thinks that food subsidies make sense, that this should be a market-driven phenomenon, not a government-driven phenomenon. What would happen if all of a sudden you did that? Price of food would go up. Now, that
I'm
has...
not sure that's right, but I mean,
Well,
I hope that's
initially.
right. But there's a lot of interesting. I mean, I think subsidizing sugar is a really bad idea. I don't think we should be doing it. But from the economists I've talked to, and agricultural economists, you know, you must take everything they say with a grain of salt. But
Or sugar.
or sugar.
Well, some white substance.
But that the incentives farmers have to limit themselves to corn and soy go even deeper than the subsidies at this point. And if you've spent time on these farms in Iowa, it's very interesting to see how it's done. I mean, yes, we subsidize them when we encourage them to grow corn and soy, but the industry that we so encouraged, the technology, the breeding of the seeds, the infrastructure, makes it very hard for them to get out of it. And that farmers will continue to overproduce these crops, partly because they're so easy to grow now. And that the average corn and bean farmer, you know, it's very hard to get them to actually get specific, but it really only takes 6 or 7 weeks of full-time labor a year to grow your year's worth of corn and soy. Now, that sounds like a good deal, except what happens to that time? Well, the farmer subsidizes it by driving a truck or taking a job, usually in the healthcare industry in town. So simply, if we were to go cold turkey on subsidies, I don't know for sure that that would have the desired effect of making cheap calories
What if
more
we
dear.
subsidized fruits and vegetables?
Well, that's an interesting option. It's very hard to do that. Typically, we subsidize production, as with corn and soy. If you subsidize production of broccoli, the problem is it's very hard to subsidize something that isn't a storable commodity, and you get these spasms of overproduction as soon as you subsidize it. And what do you do if you have a too much broccoli. You saw that imagery that Peter and Faith had of carrots when we overproduce carrots. So you really, on vegetables, you have to subsidize demand, I think. You have to put vouchers in people's hands, like these prescriptions that we were talking about earlier today, to stimulate the buying of it and the consumption of it. But stimulating the production is a lot harder to do. It's very complex, pulling these levers and not having unintended consequences.
No argument. People don't necessarily recognize what happens when commodities decrease in availability. A couple of years ago, about three years ago, The Economist reported that we had taken a lot of our corn crop and turned it to ethanol, very specifically for gas. That was the beginning of the rice riots in Thailand, and now we have a new government there. So, it has unintended consequences, not necessarily even within our shores, but, global changes. So we are that connected now that it actually, this is, no matter what happens, there's going to be the law of unintended consequences. That I do agree with.
And I think that we've also lost our ability. The government and other governments as well had a certain amount of control over the price of these key commodities through grain reserves. And so if the price of corn or wheat got too high, the government could sell it. If it got too low, they could buy. And we've dismantled those. So actually we've lost control over the price of these commodities, which is another part of the problem. And the reason we dismantled them is that it was free market faith, and that people who want to speculate in these commodities don't like the idea of a government actually having any control over the valve.
Well, if that's the case, how come our oil reserves don't control the price at the pump?
Well, yeah, because they would have to be much bigger than they are.
So, Michael, just because one of our favorite topics for the public forum has been the Farm Bill. Over the last few years, last time it came around, we talked about it, and we said, how does this affect it? People were mostly talking about fuel then, and whether or not it was going to be fueling the cars of the future. That didn't turn out quite the way some of us in the Valley had hoped. But the Farm Bill is back up again. What should people who care about this be looking for?
Well, we're going to have another, every 5 years this bill comes around. It's a very important piece of legislation. I've talked about it here before. Because it basically does set the rules of the game by which most of us eat. It's got all the nutrition programs, well, not all of them, but most of the nutrition programs. It has the crop subsidies. It has the conservation programs, which are very, very important. It has all these wonderful experiments, farmers market vouchers, money to accept SNAP payments at farmers markets, money to promote farmers markets. And it's going to really come under the knife this time around. And that is going to be, in some ways, a good thing, and in many ways, a bad thing. There's going to be enormous pressure on that pot of money. And one of the reasons is that crop prices are very high right now. So it's a good time to cut subsidies. And there will be cuts in subsidies. And that's probably a good thing on balance. But those of us who dreamed of cutting subsidies imagined us taking those subsidies and using it to help farmers diversify and convert to organic, and use it to stimulate demand for fresh fruits and vegetables, all those things that, say, $5 billion of direct payments could have bought. Well, it's not. It's going to go to deficit reduction. And a lot of the things we like in the Farm Bill, a lot of the things our local food economies count on, are also going to be cut. So I think this time around, I think we're going to see people just defending their turf.
Michael,
and it's not going to be...
You and I both said that we should try to get this bill renamed the Food Bill or the Food and Farm Bill. Any movement in that direction?
Well, a lot of people are talking about it that way, and I think the connections have been made between health and this piece of legislation, and that's huge. And that, it was always seen in the past as this special interest piece of legislation that was about farmers and keeping farmers whole and supporting them. About, 20 years ago, we started seriously looking at it as a piece of environmental legislation. It had a big impact on soil. It had a big impact on water pollution. And so that lens was brought to bear and still is brought to bear. But the idea that it is the most important piece of public health legislation out there is a fresher idea. And I think that to the extent we can make that the lens through which it is viewed, we will get better foreign policies. And how do you do that? Well, I think the first step is we need a big public health organization or a nonprofit that deals with health issues to begin scoring the bill. Imagine if every time there was a proposal around subsidies or around nutrition programs, a reputable organization like Pew or somebody like that would issue, here's the impact that this would have on the public health.
Like an
in
environmental
America.
impact
Exactly.
study.
That's the model, an environmental impact study. Or the way we score the healthcare bill when it was going through Congress for its impact on the deficit. We need to make that lens front and center because when you do that, many things that are now being included in that bill become absolutely unsupportable because it becomes clear that no, that provision is underwriting more type 2 diabetes, and that one is not.
That's great, and that makes a lot of sense for today. I'm worried about what's going to happen in 30, 40 years. In fact, there are some people who say the obesity epidemic is going to take care of itself because in 40 years, there won't be enough food anyway, so people will be dropping like flies. Michael Hamm is a professor of sustainable agriculture at Michigan State. Maybe you know him.
Yeah, I do.
Very, very smart guy. And they've modeled how much food it's going to take to feed America 40 years from now. And it's going to take 4 Central Valleys. Problem is, we're not even going to have 1 Central Valley because the rain runoff from the Sierras is already going. The bottom line is, we're not going to have the food, so there's going to be a lot of famine. So I'm thinking about that Egyptian Pharaoh, and Joseph and those 7 years of famine and what we should be doing before that to actually deal with that. And the Farm Bill currently doesn't even touch that question.
Well, I think that's right. But I think the discussion about feeding the world 40 years hence has been really driven by the same people who have given us the food system we now have, which is the Monsantos and the DuPonts and the people who want to further industrialize the food system to ramp up production even higher of the same commodities that we have too many of. The feed the world question is a really complicated question, and a lot of it depends on how you define your terms. If people want to eat the way Americans are now eating, in 40 years we have a tremendous problem. If the Chinese want to eat meat the way we do, 9 ounces per person per day. World Watch says I think we need 2.3 more worlds, not just Central Valleys, that to grow that much grain. I think it's probably clear we won't be able to feed 11 billion or 9 billion, whatever the number is, an American diet. That said, we now are growing enough food to feed 11 billion people if we weren't feeding half that food to animals to make animal protein, to ourselves and to our cars. Or throwing out, wasting a quarter of it. So there is plenty of food. A lot of the problem has to do with what we're eating and and how we're squandering it.
So that brings me to a very different part of the conversation that we wanted to go to, which is how do we teach people to cook again? And how do we bring food and the social relation and community, which would help change the diet, reduce the sugar, reduce some of the things we don't like, make it yourself, become celebratory. How do we bring that back? And what are you seeing about bringing those things back in?
Most people I meet think that cooking is too hard. They don't know how to do it, and especially they don't have time to do it. This is the thing that I hear most today. My experience is that it's possible to make very delicious food very efficiently, quickly, relatively easily. I think cooking with other people is one of the great human joys. And I love to teach people to cook. I love to cook with other people. So I do that. I try to do that by example and just show people that you can do it. I think this is it's a cultural phenomenon here. It's gotten much worse. But I think a big one to overcome is this idea that there's no time.
Well, there is no time because we've got 2-parent working families. And the bottom line is, that and they have to work in order to be able to, subsist in our current American dream, which is now our American nightmare. So, I understand this very well. We see this all the time in our, patient population, that there's just no time to be able to cook. they've also lost the ability. I mean, it was something that was passed down from generation to generation. Well, you know what? The current generation doesn't know how, so the next generation's not going to know how either.
Well, just like in the Jamie Oliver program, they showed children vegetables and they couldn't identify them. They couldn't pick out the potatoes where the French fry came from, which was fascinating. There was a recent program that talked about Trader Joe's as the place people go who want to pretend they can cook but really can't. And
A large
Eat. And how do you make a kid eat their broccoli? How do you make a kid even, like broccoli? The fact of the matter is, one of the reasons that some foods are sweet was because evolutionarily, sweet foods meant it was safe.
Right.
So we have our program for sweet. You said it very well in Botany of Desire when your kid ate the first spoonful of ice I think it was frosting on the birthday cake, and he looked at you and said, "You've been holding out on me."
Yeah. And he was only one.
Right. So kids will gravitate toward that immediately. The data on kids and food says that you have to offer a food about somewhere between 11 and 15 times before you'll get a kid to do that. So what do you have to do in order to be able to have the time to offer something 11 to 15 times? Well, there's your time right there. That's what's missing, the ability to be able to do that.
Well, and it's a parenting issue too. I mean, you've got a situation where many of us, as parents, and I have been guilty of this too, we become short order cooks. And we try to please our kids and don't just put one thing on the table, but put more than one. And and this comes out of the whole culture of marketing. I mean, food is now marketed to segments of the family. It's not marketed to mom or dad to buy for the kids. Go down the prepared food aisles at a Safeway, and you will see that they're food specifically for women who are dieting, men who just want as much food as possible, contains 1 pound of food, the manhandler. And then stuff for teenage girls and stuff for 8-year-old boys. And you end up, when you segment the family into markets like that, you end up buying more than one of those products. And of course, everybody ends up eating more. And so that idea of one meal on the table, decided by a parent, kids either eat it or don't. I mean, that idea has been, is gone, is extinct.
The speed and the need was the evolution of restaurants. And restaurants were community dining. They were where people came together to eat. And yet we don't really have that communal dining environment anymore. And very few restaurants, and Andy's, yours are the exception, can you go in and feel comfortable ordering from the menu and feeling like, this is going to make me more well, as opposed to, I'm not so sure. So there really is a question, how do we deal with this time speed issue? Do we have to bring cooking back into the schools? Do we have to change our restaurants? Do we need to create community kitchens?
all of that.
On that order, tomorrow I'm leaving for San Antonio to participate in a symposium at the Culinary Institute of America called Healthy Kids, Healthy Flavors, where we're going to actually get the chefs of tomorrow to buy into changing the conversation.
You know,
This is a very tough thing to do, having just watched the Top Chef Masters round where someone got kicked out for making a veggie burger to replace a bacon cheeseburger because he couldn't convince the Biggest Loser contestant that was better for them. And the rest of the chefs couldn't figure out how to make meals without butter. I think that chef training is nowhere near what we need to do to teach people who are taking responsibility for American health, at least for people who are eating in restaurants.
Yeah, but it's a start.
It's a start. Go for it.
But I don't think we should give up on cooking. I mean, I agree with Bob that we're very busy, but we managed to find time for things we value. In the last 10 years, we have found 2 hours a day to deal with the internet. Day is still 24 hours long. Where'd we get that time? Well, some of us are stealing it from our employers. We know that all that Amazon shopping, you know, it happens on Mondays.
Well, and
But-
and guilt happens at 9 a.m. on the East Coast or West Coast and
Right.
noon on the East Coast, so we know where it's coming from.
Social gaming, a tremendous amount of new time is being given to that. So we've had these new time sucks come up, even in this period where we're both working. And for some reason, cooking is not a priority. So that's a cultural question. That's a norm that